Welcome to the Colostomy Irrigation Information Session. This session is not intended to provide instruction on colostomy irrigation, and always consult an ostomy specialist or healthcare provider for proper guidance and to address any questions or concerns. We'll discuss what is colostomy irrigation, what are the benefits, who is eligible, and frequently asked questions. My name is Dawnette, and I'm the moderator for today's session, and I'm also the president and founder of Ostomy 101, a nonprofit organization whose mission it is to improve access to ostomy resources and information worldwide. You'll be able to review today's session, connect with the resources we discuss, and find additional information at ostomy101.com. Click on the irrigation button. Leading our session today is Joy Hooper, a dedicated nurse with over 23 years of experience as a certified wound, ostomy, and continence nurse in South Georgia. She's a pioneer in the field, having developed the anatomical apron, created an ostomy clinic, founded an ostomy support group, and advocated for digestive diseases in Washington, D.C. She was honored as the UOAA 2019 WCN of the Year and is a lead instructor for the National Ostomy Certification courses, demonstrating her commitment to enhancing care and education in the ostomy community. Now let's get started with some questions and answers with Joy Hooper. What is colostomy irrigation?
Well, colostomy irrigation involves the installation of lukewarm tap water into the stoma. And this installation of water stimulates peristalsis or contractions of the colon, leading to the elimination of their stool, or what's referred to as their return. Colostomy irrigation is a well-established option that's used by some individuals with a descending or sigmoid colostomy to regulate and manage their output.
What are the benefits to colostomy irrigation?
Irrigation is considered a safe and effective method for a certain degree of bowel control that can result in fecal continence and then also reduced pouch usage. This procedure has the potential to improve the individual's quality of life, their body image, their confidence, and reduce patient anxiety. Some individuals feel it's a really big bonus not to have to wear a traditional pouch and only have to wear a stoma cap.
Is everyone with an ostomy eligible to irrigate?
No, the appropriate individuals for colostomy irrigation are those that have the left-sided stoma. That's going to be, again, the descending or sigmoid colostomy, who had regular bowel habits before they had ostomy surgery. So not all individuals, with a colostomy are going to be appropriate for irrigation. And the procedure is generally contraindicated during the first 2 to 3 months after surgery. And then different health conditions that can cause colostomy irrigation to be contraindicated are going to include having active diverticular disease or active Crohn's or ulcerative colitis. Also experiencing persistent diarrhea, because that couldn't be regulated, or having stoma prolapse or stoma stenosis, or a peristomal hernia. All of those are contraindications, as well as having a fistula. And then having severe cardiovascular insufficiency, kidney disease, and dementia are contraindications. And so is ongoing or prior radiation or chemo to the abdominal area. And then finally, having visual impairment and or poor manual dexterity, those are also contraindications.
What if I don't know if I have a health condition that is not suitable for irrigation?
Well, you would want to discuss your interest in colostomy irrigation with your colorectal doctor or with your surgeon.
What if I decide that I'd like to irrigate? Can I just call my supply company and order irrigation supplies?
Well, that depends. If you want reimbursement from your insurance carrier, you're going to need to obtain a prescription for the supplies from your doctor. If your doctor agrees that you're a candidate for irrigation, he or she can fax or email the prescription to your ostomy distributor, your DME. However, if you're going to purchase the supplies independently, you may not need the prescription.
What supplies do you need to irrigate?
For irrigation, you want to get the irrigation kit. So this is the irrigation bag. It's a plastic bag, and this one happens to have a temperature gauge on it right there. It's got tubing and a nice silicone cone that's very flexible at the end. This one also has a thumb regulator, and it's got a little wheel that spins around to show you how fast your water's going in. So this is your irrigation bag. And then you'll also wear an irrigation sleeve. And so it goes around your body with a belt. This is actually a two-piece system with the belt, but they do make it in a one-piece system as well. And I know these sleeves look really, really long, and that's so you can stand and face the toilet, and the sleeve can reach all the way down into the toilet bowl for the water to leave your body and go through the sleeve. Now, some people may want to cut the sleeve shorter and sit down to do their irrigation. That's just fine. But to close up the irrigation sleeve, you would simply use one of the clamps.
Who makes the irrigation supplies?
Generally, the same companies who manufacture the colostomy supplies also are going to manufacture the irrigation supplies. So we recommend that you contact your customer representative at your DME or where you buy your ostomy supplies.
Does insurance generally cover irrigation supplies?
Yes, most insurance plans do cover irrigation supplies, but the extent of coverage is going to vary. Insurance companies have strict rules about the quantity of each supply that's going to be covered. The customer representatives at your insurance company and your ostomy supply distributor can let you know about the quantity limitations and prescription requirements.
And who should I contact to obtain a prescription for colostomy irrigation supplies?
Well, you would want to reach out and contact your colorectal doctor or the surgeon that performs your procedure.
How do I learn to irrigate, and do you teach me?
Well, you can consult with an ostomy specialist in your area. The United Ostomy Associations of America's website has a link to locate certified ostomy nurses. It's under the Find an Ostomy Nurse. And this is going to be able to help you locate both a WOC nurse or an OMS, an ostomy management specialist. The UOAA website also has a link to locate outpatient ostomy services. It's the Outpatient Ostomy Services Locator. Because sometimes locating an irrigation specialist in your local area can be complex and frustrating experience for many individuals. So before individuals actually research the UOAA database for a specialist, they should first try to navigate their existing health network. Another possible source of information may be other individuals that already irrigate and also members of the UOAA support group.
Where's the best place to learn how to irrigate?
I feel like the ideal place to learn is in the bathroom where you're going to irrigate. I've provided instruction and demonstration to patients in the hospital, in their home, and in my clinic. And I've found that people are always more comfortable in their own home, in their own bathroom, where they know where everything is. Because an important part of learning how to irrigate is figuring out how to organize the supplies in your bathroom.
How long does it take to irrigate?
Well, after you've set up your irrigation supplies, the length of time it takes to complete the procedure varies with each individual, and then it can also vary each time the individual irrigates. But generally, most of the contents are expelled in approximately 45 minutes after the water's been instilled into the stoma for many individuals. But with practice, the procedure gets easier and may take less time.
How often should I irrigate?
Well, during the initial 10 to 14 days, most ostomy specialists recommend irrigating daily. But once you feel confident with the procedure and your output stabilizes, you may find you can irrigate every other day. Every individual is different. Some people need a few weeks to fully grasp the process and feel comfortable with it. And additionally, some people may take several weeks for their body to achieve the predictable bow pattern with colostomy irrigation.
Will irrigation hurt when I insert the cone into my stoma?
Inserting the cone into your stoma during ostomy irrigation should not be painful if done correctly. However, you may experience slight discomfort or a little resistance, especially if the cone isn't sufficiently lubricated. And if you feel significant pain, the individual should stop and consult their healthcare provider. Most individuals use a water-based lubricant on the cone tip before insertion to ease the process. And you should never force the cone into your stoma. You need to insert it gently, mostly using a twisting motion. And then if you experience cramping during the irrigation, it could mean that there was air in the tubing, or the water is flowing in too fast, or the water could be too cold. So adjust the flow rate or water temperature to remedy that.
Can my output become dependent on colostomy irrigation?
Well, dependence is not likely, but everybody's different. So should you decide to stop, you may not have output for a couple of days and find that it's beneficial to really increase those fluids and the fibrous foods. That's going to vary from person to person.
What signs should trigger a call to my healthcare provider?
Well, you should contact your healthcare provider if you notice a bulge or a hernia around your stoma, or notice a change in your stoma's size or shape. Also, if you experience significant pain when you insert the cone, or if you notice bleeding or unusual discomfort after the insertion of the cone, or even if you consistently have trouble inserting the cone. Also, you should contact your healthcare provider if you experience extreme nausea and vomiting with irrigations. Also, if you experience stomach cramps that last more than a few hours. And finally, if you experience significant decrease in your output or your irrigation return.
Is there a learning curve to irrigation, and what should I expect the first few times?
Oh, yes, there's a definite learning curve. It'll take some time and practice to become skilled at performing the procedure correctly. New users might find the process initially complex, requiring coordination with multiple parts of the irrigation kit and understanding the right water flow and timing. So consistency, patience, and practice is key to mastering the technique and achieving optimal results. Even learning to organize the supplies in your bathroom takes time and experience. But you'll identify what you need to have close at hand and where to best hang the irrigation bag so it's high enough to where you can sit or stand. And with time, you'll learn how to best position the cone so that the water flows into the stoma and not into the sleeve. A couple other tips are the time of day that the person wants to irrigate is an individual choice, but it needs to be done within the same 2-hour time period each day. And then some individuals find it helpful to drink a full glass of water before the irrigation session to avoid dehydration and prompt a better return. Finally, I want to say, providing these questions and answers, we're not giving you directions for colostomy irrigation. You always want to consult with your ostomy specialist or healthcare provider for proper instructions and to address any concerns.
Join us at the Colostomy Irrigation Roundtable, a discussion group that empowers and supports individuals who irrigate worldwide. It's a warm, welcoming community where you can connect with others, share experiences, and learn from one another. These virtual meetings are held every other month, and the dates and links are available at ostomy101.com. A reminder of where you can review this session, easily connect with the resources discussed, and find additional information. Thank you for joining us.